So our advisor, Honorable Advisor Sir Kazito Kinimi has just joined. Sorry for the delay. He has been our advisor for a year now. He is advisor to CAWD. He was yesterday. He was at the remote place in one of the districts for the inaugural of the Deputy Commissioner's bungalow, and also to interact with the District Disaster Management Authority members. So he just returned yesterday, and because of the unavoidable traffic jam here in Kohima, he has been a little late. We are also very, very glad to have him in the launching program of COVID-19 Academy-Nagaland. We are also blessed with Dr. Nian, who is representing the Principal Director of Health and Family Welfare, Government of Nagaland. We are also blessed with Sir Vikrant Mahajan, the CEO of Sphere India. Because of this organization, Sphere India, this COVID-19 Academy-Nagaland is able to take shape and launch today. We are also blessed by other members here from WHO, from Sphere India, from UNICEF. We are very, very thankful to them for their support and for the guidance to make these occasions as successful. Now I would like to request our honorable member, Sir Kamal Kishore from the National Disaster Management Authority, Government of India, to please kindly give us the keynote address.
Good morning, everyone, and thank you very much, Johnny, for that introduction, very generous introduction. I am delighted to be with you this morning at this important event. Greetings to everyone, to your senior advisor, as well as other colleagues from Nagaland State Disaster Management Authority, Sphere India, and other organizations. I think I would first like to say that it is really commendable that Nagaland SDMA has taken this initiative to work with alongside
Sorry, members. Earlier, our honorable member, Sir Kamal Kishore, was saying that he has a very low bandwidth today. Maybe probably because of that, he has been, his line is disconnected.
Hello?
Yes, sir, we can hear you, sir.
Were you able to hear me earlier or not?
For some time, you were cut off, sir.
Okay, I will start again from the beginning then. So thank you very much, Johnny, for introducing me and inviting me to this event. Greetings to all colleagues, your senior advisor who's just joined us, as well as colleagues from Sphere organizations. I am very appreciative of the initiative taken by the Nagaland State Disaster Management Authority to organize this academy alongside in collaboration with Sphere. I think this will be an important contribution to our efforts in dealing with COVID-19 and beyond. I just want to, by way of my keynote, I just want to say three key things. Number one, I want to say that while at the all India level, COVID-19 cases are coming down, there seems to be light at the end of the tunnel. There are promising developments on the vaccine as well. while these things are happening, there are still areas where there are hotspots. There are, Delhi has experienced a third peak. We had the first peak in June, and once we got over it, we were happy about it. But then we were hit by another peak. We managed that, and we were happy about it. And then we had a third peak. So I think what we are seeing in some of these hotspots basically indicates that we cannot be complacent. Despite the fact that the all India numbers are going down, and despite the fact that we have the promise of vaccine on the horizon, it is wise to not lower our guard. And in that context, I think it is really important the kind of work that Nagaland SDMA is doing, offering this COVID-19. We really have to take out the message of all the precautions that need to be taken. Mask wearing as a norm, distance of minimum 2 meters, washing our hands, where it is possible, even in winter months, keep our surroundings ventilated as much as possible, do all gatherings when they are absolutely necessary in the open air, etc. I think it is really important to sort of continue to hammer this point again and again. We really have to increase our compliance and not be complacent about it. Because, even if vaccine comes tomorrow, I think it will take time before it reaches every single person. So within that time frame, we still have to continue to follow these no regrets solutions. Now, in doing this, we've been prescriptive that, you do these 4 things and you'll be fine. But as practitioners, it is also our duty that when we engage with our communities, we also talk about why we are trying to do that. So it's not just, adopting these measures for the sake of it, but what effect this achieves in terms of containing the spread of the virus. So my conviction is that once we begin to talk about why alongside what, we will also see that communities themselves will come up with additional solutions, newer solutions, which will help us manage the effect of the pandemic and beyond. So that's one thing. The second point I would like to make is that, of course, the economic distress caused by COVID-19 has been enormous. There is no sector of the economy which has been left untouched. So we really have to figure out ways to balance the two. While containing the pandemic, we also start economic activity. So what are the solutions? What economic activities are relatively low risk, which we can prioritize? Economic activities where people come together in confined spaces, how we can modify those in order to be able to not only restart those economic activities, but reinvigorate them while also adopting highest possible standards of safety with regards to COVID-19. That's my second point. My third point is that a number of the organizations represented here work on public health issues in general as well. I think it is high time that we do not waste the disaster that this pandemic has been. We really have to imbibe the lessons from COVID-19 and see what does it mean for the future of health infrastructure in the country at different levels. And when I talk about health infrastructure, I'm not just talking about the primary healthcare centers, the district hospitals, and the tertiary care hospitals. I'm also talking about all the allied services, the Watson services, the other nutritional services, etc. We really have to see what are the lessons we've drawn in terms of how we could have strengthened our health infrastructure systems to deal with the impact of COVID-19 and future such pandemic. So I would encourage ourselves to continuously swap the lessons that we've got with regards to public health infrastructure specifically, and see how we are going to sort of build back better our health infrastructure systems beyond the pandemic, so that we not only manage COVID-19 very well, but also any such future threats. With that, thank you very much. Congratulations again to Nagaland SDMA, as well as Sphere India, and all the organizations participating in this. This is a very important initiative. From the NDMA side, we stand ready to help you in whatever ways we can to move this agenda forward and make our country recover very quickly from the current pandemic, but also recover more resilient than we've ever been before. Thank you very much. Jai Hind.
Thank you, Satyaman Kishore, for the keynote address that you have given to us, and we always are thankful to you for your support, for your active engagement in all spheres, especially in regard to the ventures of disaster risk reduction here in the country. We thank you for the 3 key points that you have given to us. I think those are very, very imperative, and I believe this academy would be able to at least throw some light to understand better. As we say in the disaster management motto, while hoping for the best, we are also prepared to face the worst. I think with this note, sir, thank you so very much for your time, for the message that you have given to us, and for being part of this COVID-19 Academy-Nagaland. Now, I would like to request our Honorable Advisor, Sir Kazito Kinimi, the Advisor for NSDMA and CAWD from the Government of Nagaland, please kindly give us his special guest address to us.
A very good morning to you all. At the outset, I would like to express my sincere appreciation to each and every one of you for taking the time to join the launching program of this COVID-19 Academy. I, on behalf of Nagaland State, also extend my special appreciation and thanks to Shri Kamal Kishore, Member, NDMA, MHA, Government of India. Shri Dinesh Chandras Vista, Joint Director, NIDMA, MHA, Government of India. Shri Vikram Mahajan, CEO, Sphere India. Dr. Subhajit Bhattacharjee, Sub-Regional Team, Led WHO. Dr. Maulik Shah, Health Specialist, UNICEF, for your presence and all the support for the launching of this COVID-19 Academy. As all know, this year the COVID-19 pandemic has disturbed many of our activities and has affected all of us unprepared. The whole state has worked very hard in the containment and management of COVID-19 case in Nagaland. Through this platform, I would like to express my sincere gratitude to all of our government officials, medical service, NGOs, faith-based organization, FDO, and community first responders, CFRS, and everyone here for rendering your extraordinary service during this tough time. As COVID-19 is here to stay and we need to be better prepared for the coming days. NSDMA, in collaboration with Sphere India, in launching this COVID-19 Academy, with hope to import scientific and technical knowledge and better understanding about COVID-19 to all of our fellow citizens who go out of their way to serve our people in this pandemic. This is a great opportunity to get one-on-one interaction with the expert on COVID-19. It is a high time for us to learn to live and cope with COVID-19 with right information, the new normal. The COVID-19 Academy has laid up powerful session through which we hope all you will be better equipped with the proper guidance and training to save yourself and people around you and the people you look after in a much more efficient way. The completion of this academy will also help you understand the ways the whole world is taking this issue, and you will also get to learn about issues such as disability, inclusive care, mental and social issue since and stigma of COVID-19 and the genetics variant of COVID-19. I am thankful to all the resource persons who have to be a part of the academy, and my best wishes to all of them. I hope you will join each session and learn to live through this pandemic. Thank you very much.
Thank you, Sir Kazito Kinibi, our Honorable Advisor, for the special guest address. We would like to request Sri Dennis Chanda Basista, our Joint Director in IDM, to please kindly give us his address. Sir Dennis is there? Sir, please kindly speak to us. Looks like Sir Dennis is not yet joined. I would like to request now our Sir Abhijit Sinha, our Principal Secretary Home, and who is also the HOD of the NSDMA, to please kindly speak to us.
Thank you, Johnny. Honorable Advisor and Honorable Member of NGOs. The way COVID-19 crisis developed from the start of this year, like one thing became very clear as new things keep coming up. Whatever we are doing or whatever we knew of the virus was a bit different from what we were doing 1 month or say 2 months back. I mean, whatever strategies we are developing and whatever new things which were coming up, it was like while learning the things. Of course, this was expected, and this is what could have been, I mean, in any other case also, because such a crisis we had not faced. In fact, the last 100 years, I mean, second time we're facing the last 100 years. Whatever other crisis disasters that we have been facing, we faced in the last so many years, like many things are known, the way our strategies are to be laid on the ground and our things that we should be doing. It's well laid out and everybody knows what is to be done. But this COVID-19, right from March, in fact in Nagaland, most of the things started happening in March only. And we found out that every day we had to learn some new things. And even now, after 8 months, we are finding that still there are many things which come up all of a sudden, and we again change our strategies. And then one thing that way this crisis came up, it was not limited only to this medical part, which was one part, of course. And there, compared to many other states in India, somehow Nagaland physical management, I would say, has been very good, because our percentages per the deaths and the number of cases is lower than what the national averages have been, much lower than many other states. So that part got done. But the accompanying economic disaster, accompanied because of this lockdown and others, and the stigma and the problems stopping people from outside to come. That I felt was even a bigger challenge to handle. And looking back at the way we did it, I think we could have done it in a better way. In hindsight, we can always think like that. But that also brings us the importance of knowledge. I mean, now 8-9 months later on, we can say that this is what we should be doing. And though, as Kamal Kishore sir also mentioned, that there are some very promising developments on the vaccine front, but though it may be some 6, 7, 8 months, even a year before everybody gets a vaccine, or more than that. I think here also, I think one has to be optimistic if we say a year for India, because given our population. So we have to live with it for 1 or 2 more years. That is, if the vaccine, whichever comes out, is highly successful. That also we don't know yet. So we have to live with it, and based on our 8 months experience, whatever we know, based in India, other states, entire world, we have to now accordingly monitor and change our strategies, keep on changing also. So in that context, this COVID-19 Academy, that sessions which have been planned in the 5 days, I think is very important. Because nobody, even now, I think, knows fully well how this thing will pan out eventually. And as I said, that 8 months later on, whatever we did in March, April, looks to be like so many mistakes we did. So there is no reason now to not learn from whatever experiences we have gathered in this so many months. And these sessions, there are some sessions, the last session, Johnny, we were doing on COVID-19 and genetic variants. I think genetic variants, the medical people may be able to tell in a better way, but if at all there are variations, I don't know, the vaccine may not be that successful, because if that genetic mutation happens. But that is the medical part. But for me, I mean, I will also stress upon this economic distress, which happened in a very big way initially. Though things are much on track now because we've opened up so many things, but as we open up, the cases also increase. So balance has to be struck, and that has to be struck in a very nuanced manner. Festivities and other things, non-essential things, so we can ask people not to do. But the crowds and other things which eventually gather, though you may not like it or we may try our best, the more economic activity we have, people will come in contact with each other. So all those behavioral changes that one has to keep on making, and understanding that this is going to stay for a very long time, if not long, at least 1-2 years, definitely 2 years, I think, in our context in India. So the behavioral changes we have to do, and I'm happy that many are doing also. Behavioral changes accompanied with the proper science. So there our medical team is always there to help us. And this 5-day session, let's build on whatever we have known and learned, our state also, other states also. And we have many speakers, so we'll also bank upon whatever knowledge is there outside in battling this. And especially these waves, first wave, second wave. Nagaland, I think we have not seen the second wave. Some states are saying they have seen the third wave, and some other parts of the world, second wave. So that how we counter and how we manage, if at all it happens. I don't know in Nagaland whether it happens second wave or not, but if it is happening in many parts, so we should not be complacent about that. So how we handle that, and if we handle that properly without compromising on our opening activities, I think then we'll say we have been really successful, and whatever knowledge we gather from here, that will enable us to ensure that we do it properly. So my best wishes, and to the training session that we'll have from tomorrow. We have some very good speakers and people who have worked and who have good knowledge of how things are handled. And let's bank on the knowledge to accordingly make our strategies, so that we ensure that though we have opened up, we don't allow that number of cases to rise that much that we had some months back. So with this, I would like to again request Johnny to carry on with this session, and my best wishes again for the sessions that we have planned in the next 1 week.
Thank you, sir, for the very crispy and very short, indicative speech about this COVID-19 Academy. Sir has already touched upon how this COVID-19 Academy-Nagaland is trying to unfold. We are trying to reach out to the frontline workers. Some may be medical, some will be non-medical personnel. So we are trying to reach out to the NGOs, the faith-based organizations, the scientific and technical knowledge and understanding about the COVID-19. And there are various topics, and I believe there would be many participants especially from the faith-based organization here in our state. Thank you, sir, for your constant support. As I was telling in the beginning, Sir Avijitina has been one of the pillars who has been there since the beginning of the lockdown here in the state, sitting in the control room till midnight or early in the morning, trying to bring systems or ways of containment here in the state. Thank you so very much, sir, for your constant support, especially to our department. Your leadership has been good inspiration for us, a noble inspiration for us to be around. Thank you, sir. Now, I would like to request Dr. Nian from the Department of Health and Family Welfare, who is also the Nodal Officer for Disaster Management of Health and Family Welfare, and who has been also very much part of the in the COVID-19 containment here in the state. He has been the point person for the generations of various reports, the supervision and monitoring of the containment of COVID-19 here in the state. So I would like to request Dr. Nian to please kindly speak to us. Dr. Nian, can you hear us?
Yeah, okay. Okay, thank you very much, Mr. Johnny, moderator of the program, dignitaries and all participants. It gives me immense pleasure to come before this audience on behalf of the Department of Health and Family Welfare, Government of Nagaland. As has been with all novel diseases, there was limited information and understanding of COVID-19 when the department first started preparations in our response to the pandemic. In the initial period, this response translated to identifying quarantine centers, isolation treatment facilities, and also in building capacity of the healthcare workers, besides dissemination of available information to the general public. The department realized the glaring gaps in infrastructure, resources, limited knowledge in various intervention strategies and modalities, including community participation and in extension, having the confidence of the general public. The department had to struggle to overcome these challenges, taking into consideration the resources available at hand, the requirements and the realities. All the more challenging as this pandemic was never experienced in our lifetime and with no reference to fall back upon. As we are all aware, this pandemic is the biggest health and socio-economic challenge before us, needing the concerted and coordinated efforts from various sectors, both governmental and non-governmental, besides other agencies to tackle this pandemic in a way to achieve desired outcomes. As we are all aware, this COVID-19 pandemic have laid open the vast inequity and disparity prevalent in the society, especially amongst the most vulnerable sections. However, it has also provided an opportunity in seeking solutions to work towards addressing these shortcomings. One of the most glaring gaps that we have seen in this pandemic have been the deficit of proper understanding and knowledge. This holds true not only to healthcare workers, the frontline workers, the people involved directly or indirectly, but also the general public as such. Running parallel to this pandemic has been the infodemic, which has the capacity to hamper various interventions and mitigation activities. Challenges do remain in providing the right and correct information to leverage the knowledge in our concerted fight against this pandemic. At this juncture, the Health and Family Welfare Department is extremely happy, excited, and grateful to Sphere India in collaboration with National Disaster Management Authority, the World Health Organization, UNICEF, and Healthcare Foundation for coming forward to providing an enabling platform in facilitating capacity building to deliver scientific, technical, and evidence-based knowledge and understanding about COVID-19. This will go a long way in how Nagaland, with its history of strong community participation and involvement, to take upon itself in tackling this pandemic, and will also be able to provide best practices which can be replicated in other parts of the country. In recent times, we have also begun to learn the long COVID and the post-COVID sequelae. As more and more understanding of the pandemic and COVID-19 unravels, the Department of Health and Family Welfare, Government of Nagaland, will be happy and will be most forthcoming to partner with Sphere India in providing platforms to address issues of common interest, in providing capacity to the frontline workers, the community, and in creating an enabling environment as we go through this pandemic. This is only the beginning of a journey, and I wish you all the best. Thank you, and God bless.
Thank you, Dr. Nian, for your very informative sharing how we began and how in the process of working in the containment of COVID-19, what are the experiences, what are the lessons learned, and what are the gaps being identified. I think what Dr. Nian has spoken is indeed a reality that has been encountered because he has been one of the key doctor here in the state in the fight or in the response to the COVID-19 containment and prevention. Thank you, Dr. Nian, for your kind words and your support, and we really appreciate what you are doing and what the department is doing at this hour of unpreparedness of pandemic. I would like to request Dr. Selivi, who is the director of the CSIR, CIHR, who has also been one of the active doctor engaging not only in the medical practices, but engaging with the community level in spreading healthcare message, healthcare practices here in Nagaland. He would be also one of the resource person for this COVID-19 session, academy session. And we are very happy to have him. And I'm sure his sharing here would also give a lot of light and understanding about what are the challenges in the health area here in the state and what are the ways that we can equip and do better. Dr. Selipi, please kindly share your experiences. Doctor, can you please kindly check your mic? You are not audible. Doctor, we cannot hear you. Now, I think there are some technical issues with Dr. Setibi's connection. So let me request Vikrant Mahajan, our colleague and the CEO from Spear India, to please kindly speak to us. And we, from the NSDMA, on behalf of the NSDMA, we are thankful to you, Mahajanji, for your support that you have been rendering to us, to NSDMA. Please kindly share your thoughts during this occasion of launching ceremony.
Thank you so much, sir. And it's my privilege and honor today to be with all of you on this launch of Nagaland COVID Academy. Honorable Member NDMA, the senior officials from the Nagaland State Disaster Management Authority, and all other dignitaries. I'm sorry, there may be a bandwidth issue. I may not be able to put on video, but I hope I'm audible to everybody over there. And yeah, it's a very important occasion, and my congratulations to the team of NDMA, team of the Nagaland State Disaster Management Authority, who has been handling this pandemic so aptly well, and also their commitment to continue to work and be prepared not only for the changing scenarios of the current COVID situation, but also for the future pandemics, which was one of the key point the member NDMA has also highlighted. The COVID Academy has been an experience which started as a collaboration of many organizations with NDMA, NIDM, WHO, UNICEF, and over a period of time, more than 300 knowledge partners have joined the effort at a national level. It got scaled to many other states also, and has been instrumental to build capacities of frontline workers, the DDMA, and the volunteers from various civil society organizations. And I think that's the roadmap is there with Nagaland Academy also. And where I see some of the initial sessions and the information about that is very encouraging. And again, it's something I would like to congratulate Team Nagaland SDMA for achieving this. This emphasis of the academy, though it's the COVID times and we are going ahead as a COVID academy, but the definitely the emphasis will be on the containment of the impact of COVID as well as the economic impact of the consequence of economic impact, that how we mitigate that and how we come up more resilient out of it. There would be sessions planned around that. But all over at the national level, what we're discussing is that the COVID Academy also look at the preparedness for other hazard events, possibly the future epidemic, and as well as addressing the vulnerabilities. So there could be possible sessions organized onto that, and we will continue to work with Nagaland SDMA to see how we can bring future sessions and future discussions on these aspects, and also the opportunities which can be provided for the Nagaland to be part of the other mainstream discourse with other SDMAs as well as other national and international organizations at the national level. We also see that something, an element of a future preparedness, not only just for the possible pandemics, but the other hazard events, and what kind of system strengthening activities can be taken forward, both at the SDMA level and the DDMA level, within the civil society, NGOs, how a greater coordination and collaboration can be achieved between these actors, and what are the experience from other states. So I think these would be very much on the agenda of the sessions in the academy. And once again, with all this, I think it's really a privilege today to be with all of you, and my heartiest congratulations to everybody. I look forward to the future successful sessions and the successful, the conduct of academy. As Fair India, we stand committed, not just with this academy's initiative, but with what else we can bring as a collaboration to the Nagaland SDMA through the resources we have. Thank you so much. I hand it back over to you, over to the coordinator for further taking the program as per the agenda ahead.
Thank you, Vikrant, for highlighting the COVID-19 Academy in zest. Now we would like to request Subhajit Bhattacharjee, Sub-Regional Team Lead WHO, to speak to us.
Yeah. Good afternoon to everyone. So I hope I'm audible. Yeah, okay. So the NDMA, the State Disaster Management Authorities, Fair India, and our UN partners really it's a great moment for the state of Nagaland and also for Northeast to open this kind of academy, because we know that ultimately the capacity is everything. So just I would like to share one presentation for this session, a small presentation. Just hold on, share. Yeah. Okay. So, but I will talk about some part of generalized emergencies and preparedness, because definitely we are facing the pandemic, and what are the learnings and how to move ahead, and with taking this opportunity of this COVID Academy. First, it's imperative, all of us aware that the world is changing. We can see that the climate change, it's serious, having environmental impact. The international travel, it's leading to very fast migration of people, and also the diseases, unplanned urbanization, weak health infrastructure, and also the microbiological structures they're adapting, their spillover from one species to human, and lastly the antimicrobial resistance. So these all are the recent challenges which we are facing. And this is threatening the global public health security. So, and we are experiencing that because these things were highlighted since last many years, but now we are really experiencing the damage for that. So the hazards, we know there are different types of hazards. There are hydrometeorologic hazards, biological, seismic, complex. There are a lot of hazards. And in this part of the country and the globe, there are definitely the risk is very high. So if we see Northeast states, it's a very mix of culture, mix of people, having a 60% hilly districts, and also there are 57% districts sharing international border, and also many districts are flood prone. And so there is a very complex mix what we can see here at Northeast. So with this context, definitely Northeast is facing lots of unique hazards, and it may face in the future. So how this academy can help by taking from this COVID pandemic to in future also, and what are the learnings it can take, so that we can discuss it from this academy. So like we know that the Northeast is, if we see the earthquake zones of India, so it's in a very high seismic zone. So if there is an earthquake, so how to manage that and all those things. So everything comes under a proper disaster preparedness. It's the disaster management authorities are doing that. But definitely, if a more qualitative preparedness in future will help to mitigate this risk. So that is what I just wanted to point all of you. Like we have seen that floods at Assam, we have seen for Nagaland, we have seen one very severe in the Nagaland Mon district measles outbreak in 2016 and 17. So there are a huge number of cases and also a significant number of deaths when it has happened in the Nagaland-Myanmar border. So that was a learning experience for all of us in that a far-flung district, how to manage that, how the health system responds to that. So with this, what I just wanted to infer that Northeast is having a unique challenge. So it's a very good opportunity here at Northeast to start this kind of academy and take these learnings further. So this is what I just wanted to infer. Again, if I go ahead, so there are devastating consequences of disaster. We know there are direct consequences like deaths, injuries, disability. So these are direct consequences what we can measure even during this COVID. But the second and third, they are also very important. There is a disruption of the health system. There is a disruption of the health service delivery. There are a lot of health systems which are regular or ongoing. So, but there is a disruption. Okay, so these disasters can damage the health facilities. There may be interruptions of the health program, the health staff, there may be a loss, and also the clinical existing services, they may be overburdened due to this disaster. So there should be a proper preparedness, proper plan, structured plan, and well-tuned plan so that we can mitigate this risk in future. And definitely we cannot ignore what it was discussed by the NDMA person that a single emergency can set back the development gained by decades. So whatever the development being done, so there may be a lot of setback. So all these things we have to keep in mind when we are planning or approaching a disaster, and when in the non-disaster period, what we can do. So that's required. So a lot can be done. So one of the very important and interesting pointer is that there should be a sound emergency and disaster risk management for planning. And what is it is required? It is required for sustainable development, so that there is no interruption in the development process. We have to build a resilient community and health system so that it can absorb these kind of disaster very easily, and definitely comprehensive risk management. So these are the very important and interesting factors which we need to improve the quality at present. And in this emergency and disaster risk management, when we are talking about this, what we can see, there is a formula, very, very simple, that the hazard, the exposure, the vulnerability, all they are directly related to the risk. But the capacity is inversely related to the risk. That means if we increase the capacity, of the frontline worker, and if we increase the capacity of the team there in the front, and a team there in the program managers at the state level, national level, district level, block level, and also the village level, definitely we can reduce the risk. So that's a very interesting formula, and that I feel summarizes the importance of having this COVID Academy, because capacity is inversely proportional to the risk, whatever the factors we can come in our way. So that's what I just can be inferred. Even in that disaster and risk management, what can be the focus? The focus will be having a risk management approach. So, and also the emergency management, and third is health system. So health system is, because this is a health system disaster we are discussing. Definitely all the other systems, they are also involved in this whole pandemic. But definitely primarily the health systems, if the health system is strong enough to be resilient enough, then they can accept this onslaught very easily. So these are the various steps: proper surveillance mechanism, outbreak control mechanism, the pre-hospital care, the mass casualty management, the different of chemical and radiological safety, mental health. So this is an all hazard approach. So if these kind of approaches are structured in future in this COVID academy, definitely I feel it will be, Nagaland can be an example for all, not only Northeast states, other states of India and also abroad. So because that we can envisage at this point of time, and we can take those lessons. It's like this EDRMH. So what are the principles of emergency management? So the approach is what we have to think of. It has to be comprehensive. Okay, all hazards to be included. There should be intersectoral collaboration, what Mr. Vikrant also explained that a lot of the partners and they are supporting, and ultimately the government is leading the system. And the community participants, I will discuss one or two lines on this community participation and resilience there. And definitely last is ultimately integrating all these things in the health system. So if we do all these things in future, definitely we can definitely have a very strong, resilient health system which can easily take any disaster very easily and without any loss of life. So one very interesting figure, what just I've seen that in disaster, and in health, what happens in health system, the genetic factor, the environmental factor, together they form a disease. If a genetic factor, environmental factor, and in disaster also the vulnerability and capacity. So that is, and together with the hazard, because we are not able to control the hazard, but we are able to control, reduce the vulnerability and increase the capacity, and that there is a recipe for disaster. So it's disaster and also the disease, that both are same, or both are almost in similar lines. So these approaches can be taken here, so for an effective and efficient preparedness. So this disaster medicine, which is focused, so it includes not only disaster management, it includes the clinical medicine and also public health. So together, so triad approach. So together we can focus here in this COVID academy. Definitely, we are embarking on a new journey for a resilience within the country. So we have to think of like that. And here it's requiring to promote a balanced approach. It requires to identify requirement and local capabilities and gaps. So local system is important. So one shoe fit for all, it will not go. So there has to be, suppose the Nagaland concept that can be imbibed for all other Northeast states or other hilly states like Himachal and others, or Uttarakhand. So these kind of localized context that has to be taken care of when you are planning. It's like that, and definitely avoid unnecessary and damaging assistance. So this is what is required. And definitely we are as a part of UN Sustainable Goal, all of you have discussed earlier. And third goal is the goal of health, and here disaster risk reduction is one of the very important component which I want to emphasize. Regarding COVID response at Northeast states, what it came to my mind to list all these pointers, because I'm engaged with the teams there, the health team there for all the states. So what we have seen, that what wonderful leadership, the political, bureaucratic, wonderful leadership by the team. We have seen that the community quarantine system, we have seen the imposition of the laws and lockdowns, they are very, very strict. And the learnings which system can take is the customary laws imbibed within a community. Those learnings from the Nagaland state of the Nagaland and also from Northeast can be taken to make a plan for other states and other countries. So that's very much required. Also the existing high literacy rate across the states, and the engagement of our team in the front with the community. That's also one very important factor, that how we are mitigating the disaster. So these are the very interesting learnings from Northeast states, and those we can take. So we have seen that states of Northeast, they are making community quarantine centers. So these are really, really wonderful path-breaking examples which the national team can take. So my last slide is that focusing on that Northeast states have responded strategically during this COVID response, despite a relatively weaker health system. And this Nagaland Academy, which will be a wonderful opportunity for capacity building and cross-learning. Definitely cross-learning will be an important aspect. The community approach from the Northeast states like Nagaland can be a template for planning response for other states and even other countries. And also this will be a template, and it can help to prevent future disaster, like what Vikrant was mentioning, that future pandemic and disaster. So I place my wishes on behalf of the WHO team to Team Nagaland for launching this COVID academy. Thank you. Thank you for all of your time. Over to.
Thank you, Dr. Subhajiji, for very insightful presentations. I think you have also given us a new horizon to think about new topics to include the academy. Thank you for your presentations. Now, I would like to request Dr. Sedevi, the Director of CSSR, to please kindly take his time.
Okay, can you hear me now?
Yes, we can hear you loud and clear now.
Okay, thanks. Yeah, I'd like to congratulate the NSDMA and CIO India for having started this COVID-19 Academy. This is a very necessary initiative. And I'd just like to share some thoughts. We have a very unusual situation now with the COVID, and we have had some few parallels recently in the past, like SARS, MERS, Ebola, Zika, swine flu, and various other conditions which affected local regions and became a little spread out. Each of these caused alarm, and at that point of time, people felt that these could be controlled to some extent, and there was some hope which existed. If we could find a cure and normalcy would resume. And if we survived it, then we would, we would, things would become normal again. But COVID has been a situation where we seem to have almost lost hope. I mean, at least till a few months back, and economies have collapsed, and life as we knew it would not be the same anymore. The new normal has been ushered in, and some industries collapsed while others thrived and emerged, as we know, and new technologies and methods have been ushered in. Now, this has been a situation which is very unusual. Whenever there is a disaster, there are people who are the people who are most affected, and there are other people who try to support them. Like some rich countries would support poorer countries. But in this situation, both the donors and receivers were at the receiving end, and there were no more class distinctions or country-wise sparing or protection. Everybody was affected equally. In terms of the type of people affected, we know that the elderly and people with comorbid conditions have a higher mortality. However, your immunity or your seeming good health is not a protection completely. You might be a young fellow. Generally, we know now that most young people do not get very bad infections, then they are almost going to survive. In our own hospital, I think almost 100 or so of our staff would have been affected. Not a single one died. But we also know that in other places, like many of the medical colleges, quite a few of the junior doctors who are young people did die. So even though you have a good, healthy body, it doesn't mean that you are protected. So you may have an overactive immune response, which can be actually quite harmful. People talk about the cytokine storm, and healthy athletes could succumb as much as diabetic, elderly, obese people. In our own experience, we were very scared that all our cancer patients and our kidney dialysis patients, we have a large number of them. We thought that they might be affected very badly. And to our surprise, almost everybody who was affected, the kidney patients who were on dialysis, they all survived and they did quite well. So it is not entirely true that only all these comorbid people are going to go downhill. So we are still trying to understand this disease. We have understood a lot. Lot of information is now with us, but we are still learning new things. We understand that there are a lot of resource constraints which have been realized. We all know the constraints in terms of PPE, testing, relief, new facilities, etc. But we also know that, like in any disaster situation, there can always be an unequal distribution of resources. Sometimes you have too much in one location, there's a huge wastage there, and then another place there's a scarcity of those resources. So identifying the right allocation of resources is a key thing in disaster management. And coordinating these resource allocations is a challenge and will require a lot of fine-tuning. How to go about resource allocation is, I think, one area where we need to do a lot of study and working together to define and make much more effective. In terms of communications during this situation, like Dr. Nyantang was talking about the infodemic, information overload. But it's not just the information overload, but how we interpret the data which is coming. We have a lot of people talking about the death rate, the survival rate, and things like that. And we realize that a lot of people, like the media who project these things, they don't understand a little bit about how to interpret this data. And therefore, it's very important that the media needs training in interpretation of data. I think the media needs to be taught statistics and how to understand and interpret statistics. Very, very important for Nagaland especially. We also know that guidelines, guidelines can be given, and there were guidelines being coming at a very fast pace from ICMR, from Ministry of Health, from WHO, from CDC, Atlanta, and also from the Nagaland state government. Now the problem with guidelines is how is it projected? What media are you using it? The guidelines need to be interpreted, understood, only then can it be used meaningfully. So just giving a circular is not enough. It causes a lot of chaos because people don't know whether we should follow today's guidelines or yesterday's guidelines, and what does this guideline actually mean. So there is a very important role for the need for public and private sector cooperation. It has to be much more dynamic than what it is currently. The weakest link in the chain can cause disaster. This needs to be identified and strengthened. Communications is extremely very important. I have been teaching communications for the last 30 years, and I realized that I've just started learning about communications. And this is something which we must really strengthen. How do we communicate? Guidelines, circulars is not communications. It is just a circular, that is it. So we need to analyze this much better. How have we responded? Across the globe, people have responded in various ways in the best possible manner. COVID, we know, has revealed our loopholes and our deficiencies, but it has also created a great opportunity to strengthen our deficits. One is, of course, COVID has helped to improve our infrastructure, especially in Nagaland. We know that Nagaland is the most underdeveloped state in the whole country, and especially the laboratory network is in a very, very bad shape, very weak. And therefore, strengthening the laboratory network, not just the BSL labs, but even the basic laboratory network is very, very important. And this is one area where most people have hardly looked at it. Strengthening the laboratory network in India also. In India itself, laboratory network is very, very weak. And that's what I've been suggesting to people, that we need to have a national laboratory network. We have the National Information Network. We have the National Knowledge Network. We have several kinds of networks, but National Laboratory Network is very, very essential. When COVID first hit the country, we were sending all our samples to Guwahati or to Dibrugarh, and people were not even thinking about how to start a BSL lab or an RT-PCR. And therefore, I had to do a little bit of, with my limited knowledge, I did a little bit of homework and started talking to the authorities in Kohima. And with that, we got a small team together and started working on it. A project proposal was written, and we got a BSL lab started. Now we have 3. But that just shows that we were extremely weak. And therefore, we need to really work on this. The BSL network is not the only thing. We have to really strengthen the laboratories all over the state, in all districts. We also need to build up the capacity and train more people. When this COVID situation started in March and April, I had suggested to the state government and also to people in Dimapur, the health authorities, and I said we have to start training. And training is different from teaching people. Training is absolutely different. How we train is very important. You can tell people, give guidelines, that is not training. If we do not do a good job of training, the outcomes and the impact will be zero. And therefore, how we do this training is something which we have to really work on very, very aggressively. I think this COVID-19 is a good platform to start. But how we work through it is going to make a difference. And in our own hospital, we got 20 of our staff trained with the CMC and Tata Trust COVID training course. Now we are also doing training for the COVID Suraksha, which is for the lay people. But what we realize is, it requires a lot of effort, to make it very, very impactful. And we need to be able to analyze whether our training is actually working or not. If we have done all the hard work, taught this to so many people, and people do not change, then our training is still useless. So we really need to work on this very, very hard. We also need to improve communications between various agencies and sectors. Now people talk about multi-sectoral involvement and engagement, and that is the right way to do and go about. But just meeting multi-sector people is not multi-sectoral involvement and engagement. We have a district task force in Dimapur, and I've been attending that, where we have people coming from various sectors and talking together. But there is not much planning. There is a lot of discussion. Something does work, but it is not good enough. It needs a much more rigorous and more effective action. So these people, the sectors have to be involved in planning, in designing, in implementation, in evaluation, all these areas, and the entire project cycle, people must be involved in each of these. Unless people are involved in the planning, you tell people you do this implementation, unless they're planning, they're involved in the planning, they will not take ownership for it. They have to be involved in the planning. They also must be involved in the evaluation of it. You can't have an expert coming and evaluating. You must do self-evaluation. And this is very, very important. I feel, I was a bit disappointed that District Task Force in Dimapur has not been meeting now for quite some time. So these meetings must not be done as and when required. It must be done on a regular basis. Every month or once in 2 weeks, it must be done regularly. And a format and a template for this must be introduced. Otherwise, just coming SOS or as and when required basis will not work. So this is something which I feel is extremely important. What are the steps for the future in disaster prevention? I think one of our speakers has talked about community social capital strengthening. I think this disaster management must become part of the curriculum in our schools. The Nagaland Board of Secondary Education must have disaster management from class 1 to class 12. We also require a lot of infrastructure improvement and process strengthening. In the entire country, in India itself, we are very weak in institutional involvement with the government in policy decisions and things like that. They take a few people like AIMS, PGI, Chandigarh, a few institutions, and they make policies. This is not all right. We need many, many more institutions involved. And this is very important even in Nagaland. You must engage very rigorously with institutions. And we also need to have rigorous audits and evaluations of all our weak areas, dispassionate ones. There is no place for having ego in this situation. I tell my staff very often, I say, we are developing an institution in Dimapur. It's a decent institution. One day, a Richter 9.4 earthquake might hit Nagaland. When that happens and it flattens our entire institution, what is going to be left? What will be left is our community engagement, and this must be our priority. How are we going to relate with people? We must relate with community not once in a while, not on a project mode, not just on a mission mode, but a relationship continuously for the entire of our lives. Build relationships, community, and continue with them. COVID is over. Don't stop with COVID. Maybe COVID situation might be over in 1 year, but you have brought this community together. Use them continuously for strengthening the disaster management prevention techniques, for the next 5 years, 10 years. So as Amitabh Bachchan says in our phones, which we listen to every day, the fight continues. It's not yet done. It's not yet over. And although there's a lot of fatigue already around, people are sort of even given up on trying, but we still have a long way to go. And I think the NSDMA has got very good leadership, and even the health department, I think, has got good leadership. I think if we can get together and work in a more coordinated fashion, we can really make a difference and really mitigate disaster and strengthen our community in this area of the country. Thank you.
Thank you, Dr. Sedebi, for giving us the insight so as to how we could improve the technical resources of health services. And I think your emphasis on the community engagement, continuous engagement of the community is indeed an asset. Thank you very much, Dr. Setibi, for your insightful thoughts and your sharing. We have Dr. Maulik Shah, who is the health specialist from UNICEF. And we are also currently working with UNICEF to bring out a disaster risk reduction roadmap for Nagaland. We hope that by the coming few months, we will be able to start that partnership where we will be engaging all the line departments and the community, NGOs and faith-based organizations to bring into the disaster risk reduction rhythm while we are planning for any developmental work. Thank you, Dr. Setibi. And now we would like to hear from Dr. Maulik Shah from UNICEF, who is the health specialist.
Yes, good morning, everyone. And first of all, I would like to thank Nagaland State Disaster Management Authority, SPEAR India, Department of Health and Family Welfare, Government of Nagaland, and other partners for giving me an opportunity to share my experience. So, firstly, I would like to congratulate also State of Nagaland for launching this COVID-19 Academy, and I'm really happy to see all concerned stakeholders, not only the state disaster management of the health department, but the all concerned stakeholders are the part of today's launch. And I would be quite brief because many areas have been covered by the previous speakers. So we all understand this is a difficult time for every one of us. And this COVID-19 pandemic has once again reiterated the fact that our health system should be the disaster resilient, as the health sector is the first one to respond, be it natural disaster or it the man-made disaster. Whenever there is a casualty, even morbidity, mortality, whatever, but the health system is the first one. So it has to be disaster resilient, so that we can continue our services for the affected population. And as everyone knows that any disaster, most vulnerable community and the people are affected the most. uh, so even with this COVID-19, the children and the elderly people, which are who are the most vulnerable people with the comorbidity, they are affected the most. So I think everyone must be aware about the fact that Nagaland has the lowest infant mortality rate in India. It is 4 as per the SIS 2018, which is compared with the 32 in India. And state has one of the very best nutrition indicators. And also I think previous speakers got about the sound community structure. We have a very strong community structure in Nagaland. Uh, have the one of the best village council also in India. But however, there are some equity issues, and some of the service indicators are also lowest in the country. As per NFHS report, two-thirds of the women are still living at the home, and the same for the partially immunized children. And with this COVID-19 pandemic, there are some more interruption in the essential service during the lockdown period. Now service have been resumed, but yes, still there is a gap in some essential services. And another challenge due to this pandemic is that routine capacity building trainings have been halted. And there has been quite long gap from the training, and there are refresher trainings also pending. And there is an unavailability of the state and district training institute. And this training institute issue is not only limited with the Nagaland, it is with the all Northeast state. And this COVID-19 has given us definitely an opportunity also to connect virtually. I would give a recent example. Currently, there is a midwifery conference going on from last 3 days, which have the participant from almost 98 countries of more than 6,000. And there has been quite a lot technical sessions are also ongoing. So this gives an opportunity. This was the first time that this many participants can connect and share the knowledge and the experiences worldwide. So this COVID-19 Academy also, I feel it's a good platform. Although we are challenged, but it's an opportunity as well. And I'm sure there will be further reinforcement of the capacity building initiative, and also the COVID-19 vaccine is knocking door. So this initiative, I think it's a very right time, and it will be quite fruitful in future. And as a UNICEF, we are closely working already with the state of Nagaland for strengthening RMNCHA initiative and immunization along with the partners. And we will definitely continue to support in the state going further. And as uh, mentioned by our colleagues from the state disaster management authority, that from upcoming years we are working closely with the Nagaland State Disaster Management Authority and the State Health and Family Welfare Department for strengthening public health preparedness for responding any public health emergency. So we will develop a roadmap to respond to any emergencies for better preparedness. And I am sure this COVID-19 Academy uh, will actually build the capacity of the state to prepare better responding any disaster in future. So I wish all the best to state and the Spear India, and we will continue to support the state in any initiative. Thank you.
Thank you, Dr. Malusa, for your kind words. Now, maybe perhaps if we have any participants would like to ask something or understand more about this COVID-19 Academy in Nagaland, we may have maybe few minutes interaction. If any participants here would like to ask some questions, or maybe even some clarification to the speakers. Looks like we are all good. I would like to sincerely thank our honorable advisor who is here with us during this launching program. I would like to also thank the honorable member of NDMA, Sir Kamal Kisorji, and all the speakers during this launch program for kind information of all the participants here. The COVID-19 Academy-Nagaland first session will begin on the 7th of December at 11 a.m. The first session topic would be basic signs of COVID-19 and also stigma of COVID-19 pandemic. And the speaker for the first session will be Dr. Kika, who is the Deputy Director from Health and Family Welfare Department, Government of Nagaland. The second session will be on the 8th of December. That would be also in the same timing, starting from 11 a.m. to 12:45 p.m. Disability Inclusive COVID-19 Pandemic Response. That will be spoken by Detano, who is the Commissioner for Disability, people with disability here in Nagaland, who is a Commissioner. And the third session will be on the 9th of this month, same time. The topic would be basic care and management of COVID-19 patient. That will be taken by Dr. Sedevi Angami, who is the Director of CIHSR. And the next session will be on the 10th, which is on Thursday. The time will be same. That will be mental health and psychosocial issues of COVID-19. The resource person will be Dr. P. Muli, member, Nagaland Medical Council. And last would be on Friday, that is on the 11th of this month, we will be talking about COVID-19 and genetic variants. I would share that topic on that. So this is the various topic which is in line for the next 1 week for the Nagaland COVID-19 Academy. I would like to request the members to please kindly share, and the target audiences are first-line workers, frontline workers, community first responders, the NGOs, and the faith-based organization members. So we hope that many more will join and benefit from this academy. As we conclude the launching program, once again, I would like to thank all the resource persons who has been really incredible, sharing your experiences, your input, and your knowledge, and also the other participants without whose participation this launching program would not have been successful. Thank you so very much. And once again, Spear India, WHO, UNICEF, the Department of Health and Family Welfare, and of course our nodal ministry, the NDMA and NIDM, for being there with us during this ceremony. Thank you very much to one and all, and have a very good day. Thank you very much.